Top issues at this year's Infectious Disease Conference include fighting MRSA, Ebola, new HIV recommendations, the flu, and vaccinations. Here with the latest research for infectious disease is my guest, Dr. Amesh Adalja with the Infectious Disease Society of America. And Dr. Adalja, the Ebola outbreak resulted in 11,000 deaths, 28,000 confirmed cases globally, some here in the U.S. Are we better prepared today to fight Ebola?
We're definitely better prepared than we were when this outbreak started, but we're not all the way there yet. Ebola taught us a lot because this was the biggest outbreak ever, and we saw a lot of things happen. We had healthcare workers getting infected in Texas. We had multiple evacuations. We learned a lot about how to treat Ebola, and we started to fortify our hospitals to be able to care for patients with contagious infectious diseases, but we still have a long ways to go.
Something that happened was this development of this, or at least some investigation into Ebola vaccine. Where does that stand today?
Well, we had some very promising data from an early Ebola vaccine where they showed about 100% protection rate. So that's really, unprecedented. There needs to be some drilling down of the data to make sure that actually holds up. But this vaccine looks very promising, and it may change the face of how we deal with Ebola outbreaks in the future. And
we also learned something else about supportive treatment, even without a vaccine.
Right. We had Ebola outbreaks in very resource-poor areas of the world where they may have been in a village and there were a handful of cases. This outbreak, because of the resources that were brought to bear, allowed us to actually try some of modern medicine's basic supportive care, like IV fluids. And what we're finding is patients with Ebola are very dehydrated. They have electrolyte abnormalities that can all be corrected with IV fluids and electrolyte supplementation, and that may be all you need to do to actually reduce the mortality rate from what was 90% down to 20 or 30%. And then the experimental drugs and all that can work on top of that. So we really learned a lot about how to treat this disease.
When it comes to other infectious diseases here in the U.S., what's the biggest concern?
The biggest concern to me is the threat of antibiotic-resistant bacteria. What we're seeing is a gradual spread of bacteria that are resistant to one or multiple antibiotics, and sometimes no antibiotic at all can treat an infection. We are left in the pre-penicillin era. And this is something that was totally predictable and totally preventable if we would use antibiotics a little more judiciously than we have. Not using it for colds and coughs and other viral type illnesses, getting our veterinarians, our dentists, everybody involved in prescribing antibiotics only when they are needed.
Do we need to discover new antibiotics?
We do need to discover new antibiotics, but we also have to get smarter about how we use the ones we do have. We shouldn't, like I said, be using them for coughs and colds where the majority of patients do get antibiotics. We also need to move beyond antibiotics, think about better vaccines, think about novel strategies to attack the bacteria more specifically. There are actually viruses that we can give people that can kill bacteria. A whole host of new approaches need to be tried.
Well, speaking of coughs and colds and things like that, San Diego's flu season peaks in February. So it's now October. Should people here wait to get a flu vaccine or a shot, or does it last?
We should get the flu vaccine really at the beginning of fall. So fall has already occurred, so people shouldn't really wait, and they should get the vaccine as soon as they can. Although if you haven't gotten the vaccine, it's December, it's still not too late to get it, but we like to have people getting the vaccine as close to the beginning of fall as possible, and then that should carry on through the rest of the season.
And a few days ago, the World Health Organization actually released new recommendations to treat HIV before symptoms start or for pre-exposure treatment. Tell us what that's about.
So we know that HIV, the longer it is in your body, the more damage it occurs. And we figured out that the earlier you treat, the better you are able to prevent the late complications of HIV and the longer a person can live. They also can become less infectious. So treatment is actually prevention. So if you're on medications and the virus is completely suppressed, it's very difficult for you to spread it to another individual. So this is all part of how we're trying to really rethink the way we treat HIV and getting people tested and put on treatment as soon as possible.
And that treatment applies to who? That sort of pre or early treatment would be to who? Not the general population.
No, treatment of people who are infected with HIV. So the earlier that they're diagnosed, the quicker you get them linked to care and put them on treatment. We know that that's what actually saves lives and prevents this infection from spreading.
Mm-hmm. And what about other treatment options? Are there any other treatment options? And did the price jump from $13.50 a pill for HIV treatment to $750 a pill? Did that influence any ways that people are being treated?
Well, there are other treatments for HIV that we're thinking about, and one of them is called pre-exposure prophylaxis, and that's where you give high-risk people, maybe men who have sex with men who have high-risk sexual encounters, we give them a medication daily to prevent them from getting infected. That's something new and innovative that we're going to see increasingly be used. With regard to the price change, that was not for an HIV-specific medication, but for a drug that's used for an infection called toxoplasmosis, which occurs in people with late-stage AIDS who end up getting what's called an opportunistic infection. So it wasn't, in fact, it wasn't impacting the treatment of HIV patients per se, but a very small proportion of them. And that actually underscores the fact you don't get toxoplasmosis if you're on HIV medications and you're well suppressed.
So get it taken care of early. Dr. Amesh Adalja, thank you so much for the update.
Thanks for having me.